Good afternoon. My name is Ms. Tearra Gee, and my expertise lies in diagnosing and treating schizophrenia. My educational background includes psychopharmacology. It is in my personal belief that staying current in your field of choice is essential, along with having a mentor. My mentor is Dr. Laura Green with the University of Arizona Global Campus. 1% of the U.S. population is diagnosed with schizophrenia. Adolescents are the dominant group, and most go undiagnosed and untreated for years for a variety of reasons, to include biological or psychological or a combination of both. Most researchers believe that the cause of schizophrenia is subcortical dopamine dysfunction. The neurological imbalance seems to be prodromal in males. The prefrontal cortex region is affected by the imbalance of dopamine, causing visual hallucinations and incoherent decision-making. In a healthy brain, dopamine acts as an inflammatory. In contrast, people living with schizophrenia will have dopamine imbalances in several areas of the brain. Researchers, such as Lasvanian et al. 2022, believes that dopamine imbalances can actually cause neuroinflammation. Neuroinflammation that goes untreated will cause the gray matter to atrophy. Loss of gray matter is associated with a loss of motor control and cognitive abilities. Antipsychotic medications alleviate symptoms created by schizophrenia by blocking the dopamine receptor D2. Popular drugs that perform this mechanism of action are quetiapine, olanzapine, and aripiprazole. Physical side effects typically include gastrointestinal discomfort. Other more serious side effects are cardiovascular disease and tardive dyskinesia. Even with continuous administration of psychoactive drugs, 58% still think about completing suicide. Patients who are undiagnosed or choose not to be treated increase their rate of mortality in the first year by completing suicide. Secondly, most people left untreated die from comorbidity issues within 15 to 20 years. People living with schizophrenia have an increase in positive symptoms that are hallucinations and delusions, and an increase in negative symptoms such as apathy and social withdrawal. There are a variety of reasons a person with schizophrenia is treatment resistant. Some may have physical symptoms that they cannot cope with. In these cases, it is acceptable to prescribe them a secondary medication to cope with physical ailments. However, some people with schizophrenia may not show any improvement in their physical well-being. This is most likely because of the complex neurological changes to the brain that occurred due to chemical imbalances. Where psychoactive drugs are not improving the quality of life for a person with schizophrenia, alternative modes of treatment exist. Cognitive behavioral therapy, CBT, has facilitated people in the prodromal stage and those with shorter duration and frequency of occurrence living with schizophrenia by introducing structure and guidance in daily living habits, helping identify controls for hallucinations, and making them aware that CBT can be taken with psychoactive drugs. The most important takeaway from this presentation is that more research is needed to better address suicide among our young adult populations. They are vulnerable for first-time experience of psychosis, cultural attitudes, and a lack of awareness about what is schizophrenia and how to properly treat it. I would like to thank God, my family support system, my employer support system, the University of Arizona Global Campus, and my mentor, Dr. Laura Green.